Good Monday morning, everyone, and welcome to Perspectives. It is Monday, 27th of September, 2021. I trust everyone is waking up to a really beautiful Monday morning. It's really busy on the road, lots of cars on the beaches. So I'm sure everybody is happy to be out after going in 4 or 5 o'clock on Friday. Of course, all for the greater good, but we understand just how, tense and a little sad and solemn and all of that the nation is. But let's try and keep hope alive as we get through these very, very, very tough times. I am Brenda Baptiste, your moderator. Wherever you are this morning joining us, we welcome you. Those of you streaming the broadcast live, MTV, on air and online, we thank you. Our own Perspectives page, Partygrenada, TNR Communications, KG9, Mikey Live, and TNR in Carriacou. We say a special good morning to the brothers and sisters on Carriacou and Pidi Martinique. And it's now time to say good morning to Senator Christopher Allie and Mr. Byron Campbell, our expert talk panelists. Good morning, guys.
Good morning, Brenda. I trust that your weekend went well.
My weekend was excellent. My weekend was filled with adventure. Through books, reading.
I was just getting worried that she left home and went to places. Byron.
Oh no! Hey, all you that hear about me, boy? What? You mad? If they catch me, so hello.
Good morning to our viewers and listeners. It's a pleasure to be back here again, another Monday morning, and trying to get ready for the week ahead. Yeah. Every week that comes these days is eventful. You don't know what is happening one day from the next.
Listen, not only eventful, I think every morning we wake up and we're here and we're cognitive. It is just, and we're ever present. It is just so much to be grateful for with everything that is happening around us.
I suppose you're correct. And that is something we have to be thankful for every day, of course. And again, my weekend was filled with work. I had, a number of things set aside for me on a list.
Sound like Mrs. Allie. Good going, so Mrs. Allie.
I knocked them off one by one. I'm completely finished. I'm still trying to get through there, but hopefully we'll get there eventually. Other than that, Byron, the hot sun and we got some interesting rain and sun this weekend, so I know the plants would have fared well.
Yes, good morning all.
Morning. You too relaxed. Sir. Time to come back to the studio. Too relaxed.
What kind of weekend? Next weekend. I mean, being a farmer, of course, it means that I was out all day Saturday. But we had some good rains yesterday. I know we have a short session this morning because we have several guests, Brenda. I want to keep, I've thought about this and I want to somehow keep this morning very positive. And you started it, Brenda, by saying, look, we have to have hope. And, but first I want to express most sympathies and condolences to all the families who lost loved ones or whose loved ones are ill. I met a mother, a wife on Friday morning when I came from the beach and she was wearing her mask. I didn't recognize her. She called me out and told me who she was, the wife of, I know her, of one who died. He was 58, just 2 years short of retirement. I mean, she was in so much pain, I just want to express, greatest sympathies and support to all those families. Having said that, colleagues, I just want to express some positive things this morning, yeah? We have something positive on the horizon there. All the indicators are, given what's happening in the Indo-Pacific region, that we've seen an an increase in the international prices for nutmegs. So that's excellent for Grenadas, for Grenada nutmeg. We'll be able to sell all we have at a premium, and that's moving in quite a good direction. And the GCNA will be out purchasing nutmegs from next week for more days of the week. So we have this is good, and it's something to look forward to. I'm very pleased about that. But just some positive thing on the numbers, colleagues, that one, we see a higher rate of recovery, increased recovery from COVID patients. Also, we have So that's going down. The rate of infection is also going down by the numbers, and that's a good trend, absolutely. So I just want to comment on that. And I also noted that the new health center in Guelph will be used from today for testing and vaccination from the 27th today. So that's a big deal, very, very, very positive. So this is just a few of the things that I think we need to highlight, and because it's a big deal and it makes a difference. And I think the uptake in vaccine is also showing positive. We need to do more, but the trend, that's important. Colleagues, back to you. Thanks.
Byron, I didn't hear you mention the prorogation of Parliament. I know that.
Oh, well, yeah, I mean, this has been floating all around the purpose. And this is, for me, I interpret it as that's the standard. We see this happening average once or twice a year. I have not personally put anything into this. I think it's normal.
I just think people didn't they understand the term. Normally, Parliament, when it is the word prorogued is used to end a session to begin another. Right. I think when it's so people got excited. Well, not that excited, maybe anxious that Parliament ended was elections. But I think just to put it simply, if I remember correctly from civics, the word dissolved is used when it's time for elections. The Parliament is dissolved, right? And it leads us into an election. When the Parliament is prorogued, the Parliament is ending one session to begin another. In this situation here, this session is ending, and the next session would see the opening with a throne speech from the Governor General, which lays the ground for the reading of the budget.
Right. One thing I know very well, Brenda, is that the Ministry of Finance is actively engaged in its budget preparation
consultations,
for 2022. I know, for example, later this week, sometime on Thursday, they have that national consultation taking place. I know this is happening. But another positive news, Chris, and this is a big deal, the small business relief program. So much small business, because we know a lot of them have been facing a lot of difficulties. And this small business support is going to make a big difference for many of them, So I think they should be contacting the Ministry of Finance or GDB and the other institutions responsible for administrating this fund. But that's going to make a difference. Relief, I call it, very important and timely.
Oh yeah, that is a major thing, that initiative announced by the government, and I hope that a lot of the small business people are able to take advantage of what is put there, and they could, some of them could get their business, give it a shot in the arm, so to speak, so that they could continue. A lot of them have lost business, have lost workers, so hopefully that could help bring them back to a point where they could see some, hope. More so than anything else, that this is what is happening. So that is a good thing, and hopefully, with this package that the government announced, some relief can be brought to some people who badly need it. So that is a good thing in all challenges that we have. I thought that the announcement by Trinidad this last week about I think it's the 11th of October, when they're going to start opening up all the gyms and the theaters and restaurants for only vaccinated persons. I thought that was a significant shift, because livelihoods are important, and they are showing that at least that is the first step, as far as they see it, to get some businesses back on track. I think that is something that we have to consider as well. We had it already, in the sense that when we had cricket, only vaccinated people could have gained entrance to come in physically and watch the match. So I think this is something we have to consider for small business, because this lockdown that we have now, the no movement weekends plus the curfew days, is really taking a toll on some of the businesses who are not listed as essential. This is going to be a month without business activity. So, and the bills are still there.
Well, it's
and of course the staff is going to want to know what's happening with them and their pay and all of that. So it's going to be tough for the businesses as we move forward in another week. And hopefully that government will see the need to open back up to some degree, as I say, if we want to put it to vaccinated people alone and all the protocols. I think we have to have some consideration for those businesses yes, we're given a incentive on one side through the stimulus package, but we also have to find a way for us to operate in this so-called new normal, where we have vaccinated and unvaccinated people in our society, and what is going to happen in terms of risk. And I think that is an important thing for us as we go forward and how we develop in this new environment that we have.
Yeah, I think what Trinidad did very brilliantly was how to communicate that they are reopening to only vaccinated. So they did not do the language. They were very, very careful with their communication. It does not say vaccinated or unvaccinated. The Prime Minister announced that Trinidad would be opening up in a safe zone concept. And by safe zones, what he meant is vaccinated, you enter the safe zone. If you're not, we're gonna we're gonna take that risk out. And the same thing is happening in Europe. The same thing is happening in the U.S. Today, if we pay attention to U.S. media, I might be quite interested, as time has run out for all these healthcare workers and teachers and so on to be vaccinated to go back to work. Thousands of them have refused to get the shot, and President Biden is saying, "I'm sorry. Until you make up your mind, you cannot come into the healthcare spaces, you cannot enter the classrooms." In Antigua, Gaston Brown announced similar, not in such a diplomatic fashion. I guess everybody have their different styles of communicating. And he was quite concerned about Grenada this week as well.
Yes, Grenada
as he made his comparisons.
In his delivery.
As he made his comparisons and so on at the Parliament. Having said all of that, though, what I agree with him, one thing I agree with him on, he said in the Parliament that he's observing, and Antigua and Grenada and all these territories are similar, so behaviors are kind of, linked. We're all island people. He said that he's observing that there's this big talk about trust, and there's this big talk about, I need more information. You present the information, and then what? Yeah? And then you include those who say, well, y'all didn't include me, and you include them, and then you end up with drama on the other hand. And I listened to that and I thought about it, and I say, is he making excuses? And the more I thought about it, I started to relate to situations here. Because now you would hear people saying, well, when the government went out on the vaccination drive, they didn't include the churches, they didn't include the NGOs. You stepped up, right? You were talking to your members. You had a captive audience as you stood in your churches and you delivered the messages. What message did you deliver? All of that is inclusion. If you're an NGO, who did you speak to? Did you coalesce your community group? Who did you talk to? So I agree with him on that front. We just seem to be putting up all these excuses. But in Grenada, the time has run out for excuses. So if we didn't do it 3 weeks ago, let's do it now. Let's just try and get a new sort of engagement. Mr. Campbell mentioned that he's hopeful about the numbers he's seen. He's hopeful. I'm not sure, because absent from there, it really is how many tests we're taking. I really don't, I guess when the minister comes this morning, he'll explain some more. And, it was really concerning. I became very emotional on Saturday as I just kept seeing image of elderly citizens going down in Carriacou, and it's just, and, I kept asking the question, what did these people do to deserve this? Some of them didn't even leave their spaces. That part of it is really troubling. And so there are a lot of things that, we as individuals first need to ask ourselves about our role in all of this, and how now at this juncture, what can we do to just lift it and move it along? Because this is just our first wave, eh?
There's one statistic that's not very encouraging. We're averaging 8 deaths a day. For a small place like Grenada.
Yes, I don't know that
120 people dying and passing on. And I just can't be.
And in 3 weeks, and it's a window because.
I should say, in other words, looking at other countries when they had their waves, 1, 2, second waves, and this is a trend they've noticed, that you find a peak in deaths at the latter part of the wave. But Chris, I want to make the point that I know you've been a pro-vaccine person, and we kind of listen to you.
You can use the word mandatory. I have no problem with that.
But
I mean,
want to take
stop coloring the thing. Stop coloring the whole thing. Stop coloring the thing. He's about mandates.
Yeah.
Let's just talk straight. That's all he wants. He wants the vaccination to be mandated for
Byron,
folks on the front lines, especially.
Sorry to interrupt your talk, but Byron, I am hearing that we have an outbreak in a mental home. And, again, 99% of the people there are confined. So how did we get them? How did we get COVID in there?
The workers.
You understand? It's either through visitors or workers. And I mean,
Nobody
I am just appalled that if people die from that in the mental home, let's hope, God forbid they don't, then, why didn't they get vaccinated? Sorry, I heard, and I know the minister is going to say they had to get permission from their families, and families would have refused and so on. But, I just of the view that in those type of institutions, for me at least, the workers at least needed to be vaccinated for them to continue working there.
And talking about the vaccinations, I think when we weigh where we are in terms of how dire the situation still is, and when you watch the vaccination uptick, listen, we're not going anywhere. Let's just be honest about it. We're not going there. We're going. And, when I left the program last week, as I was driving down Melville Street, a lady stopped me. And I didn't go to judge people, because the way she came to the vehicle, I was like, okay, what she want to beg me for this early morning? And then she said, Brenda, I have something to tell you. Just so she come, she said, I'm a nurse. She was dressed in civilian clothes. She said, I'm a nurse. She said, let me tell you something. She said, and I want you to say it on the program Monday, just so. She said, folks coming out to get vaccinated and tested. And what she's noticed is, she said she paid attention to 5 people. For the last 3 weeks, they come every single Thursday to get tested. And she said once they get a negative result from the rapid test, they're happy, they're gone. They come the next Thursday again. She said they're unvaccinated. And she said not once have any of them sought to join the lines for vaccination. I said, and you're telling me that because she said bothering me. She said, what are they coming and get tested for? I said, that's a question I would have had for you.
Well, I mean, I
she said, because they come in, she said to me, she said that the last week when they came, she was very tempted to tell them they're positive. But then she said, oh God, I can't do that. But I thought to me, she have a point. Why you keep going to get tested and you're not interested in...
Because, Brenda, they're living a life that is not following all the protocols, or they're doing what they have to do during the week, that they're putting themselves to some degree of risk, so they're coming back every other Thursday to find out their status. That is simply what it is. I'm not sure that is anything more than that. Because the fact that you're coming to get tested and not even considering vaccination is because you tell yourself you could live on the edge without vaccination, but be tested based on what you're doing or you're not doing.
Chris, I have to join you. I want to join you. I am taking this approach. And Chris, I'm not going to preamble by saying some people would be vexed with me. I don't care. I believe that the government, the state should be thinking about mandatory vaccination for certain sectors of workers. Certainly, health, security, port of entry, schools. Talking about teachers, I'm talking about all workers in the government services that interface with the public. In my view, this, it has to be mandatory. How are we going to manage the virus without a greater uptake in vaccination? Let me just point this out to something I've been picking up. Because you see, we're not out of the woods, although I mentioned positive numbers in terms of trend, but we're not out of the woods. There could be other waves. This wave could go anywhere. What I've been learning is something called, it's referred to as crisis standard of care. And a number of states, certainly including Alaska, Idaho, they've introduced this, where hospital care will be rationed. People that are deemed less likely to survive will be moved down the priority list. They now have guidance and rules. Resources will go to those who are most likely to live. They call it a wellness team. There was some discussion here when it was called ethics committee, but that's the direction everybody's going, because and this is happening in areas where there's low rate of vaccination. So we are in the same situation. So when this conversation comes out about you, in other words, and the people that would be suffering and feeling the pinch more are those that have nothing to do with COVID at all. These are the standard care that we are used to, that is going to be downgraded, that people will be suffering and not being able to get care because of the pressure, because of the acute pressure that's put on the health infrastructure as a result of, as we see, most of the persons going into hospital and dying are unvaccinated people. I mean, that's where it is. I mean, and the other thing we have to keep in mind, the amount of misinformation and rubbish that is on social network here in Grenada, everywhere, it's amazing. And we have to find ways of confronting this. It's just nonsense out there, and it's upsetting when you see that, and you know that we have a treatment with the other protocols, and I am advocate that all of these physical distancing and face masks and all of this must go together. But here we have something. I get pissed off personally about this. Where it's
Byron, interestingly,
so you're getting very, very emotional
they
about
had a number, I think the diaspora just put on a thing on a number of Grenadian doctors living in the diaspora talking about COVID, and the central theme in all of this was vaccination. No doctor that we know, whether it's Grenadian or otherwise, is talking that this is one of the ways that we can get ourselves out of this in some degree, to get vaccinated. And I don't know what else in terms of the information our people need to get to understand that vaccination is a way out, and they should consider it as a serious alternative to what they're doing. Some drinking, you can't get ginger and saffron to buy now because a lot of people are drinking that, and nothing wrong with that in the sense that if it's boosting your immune system with the zinc and the vitamin C and so on, that helps. Everybody with a strong immune system, will talk, and there are survivors who got COVID and would have developed natural immunity now, and they will tell you, well, boy, I'm over this, I have natural immunity, so why vaccinate? I know there was a study recently out of England that was saying that when you develop natural immunity, if you're vaccinated, you get, probably 10 times more protection from the virus. So, I mean, we just need to understand that there is solutions out there that we need to look at, and to get ourselves back to a place where we can enjoy what we knew post-COVID to be the things that are so Grenadian, as we say, 473 habits and the way we behave and we live.
My concern, my overarching concern, now that we at this point, is really the fact that we are in a dire situation, and I really don't know about the hopefulness of the numbers and all of that sort of thing. It just keeps happening, and what you're not seeing is okay. So COVID is a funny thing. So you may not be seeing an end game because there's nothing. Time is not on our side. So you still have a lot of people saying, "Well, I'm waiting about the vaccinations. I'm waiting to see." I don't know. Waiting to see is a subjective thing. I don't know what waiting to see is from one person to the other. But I know what we do not have is time. Grenada received vaccinations in February of 2021. We were ahead of many territories in this region, right? A lot of us, we have a little issue looking back, because looking back takes us to a place of a certain guilt, and that's okay. We can feel how we feel, but we need to get out of how we feel and act based on what is happening now. We do not have time. I am tired with the no movement weekends, but I could be tired all I want. The fact is, we need them because we don't have a lot on our sides. People are not rushing out in droves to get vaccinated. Our infection rates are not dropping significantly. The curve is not flattening as quick as it should because COVID takes its time. So if we want to move at the same pace as COVID, then we, Grenada, need to decide, have we given up? What do we want to do? I don't want to wax philosophical, but Senator Allie, that's just how I feel.
Yeah, well, we have the minister coming on shortly. He'll give us his take, I suppose. So we, as far as I'm concerned, Brenda, the numbers heading in the right direction. I know Minister will say the only number that are not heading in the right direction is the deaths. We averaging eight a day on average. But the positivity percentage, I'm certain, is coming down. I don't know if it's at 20% or less now. And I know when we started this, there was a concern with a head to the 50%
Even
range.
doctors are getting fed up and they're starting to say, listen, I'm not going to attend to unvaccinated clients, you know? And there is a concern of, I'm one person, I don't like separations and divisions. So anti this and anti that, and not everybody who doesn't want to get vaccinated is an anti-vaxxer. There's a difference, huh? There is a difference. There are people with there are some people that would never be able to be vaccinated. Let's get that straight.
No, we understand.
Yeah,
that.
let's get that
And
straight.
herd immunity doesn't say that everybody gets vaccinated. Herd immunity says that.
As for the herd immunity thing, that's a whole other topic. But fact is, our inaction as a people, whether it be with the mask wearing, whether it be when we are told to isolate, we're not, and we have so much of that. All these things, I don't get the feeling that it has yet sunk in. And here we are at about 120 of us, 119, because we had the gentleman from Birch Grove last year. So 119 of us up to yesterday, of our brothers and sisters, of people we know and love, have expired in the last 3 weeks. And yet, I ain't really had no problem with vaccine enough, but you see me, I waiting. Okay, I don't know what you're waiting for.
Brenda, look, I'm a senior citizen, and I want to know that any room I go into, any environment I go into, I want to know my status. I want to know the status of the other. I want to know to what extent that the persons I'm interfacing with in this room, if it's a meeting or if it's a social function, to what extent they are vaccinated or unvaccinated. You know, that's a right I have. And clearly, persons that are unvaccinated have to understand that they're compromising the health and life of others. You know, and that's the bottom line of it. And I think society must take a very hardline position on this. And I mentioned last time, I mean, Italy has gone to extreme, and America and other places and other countries, Antigua and other places. And I want to see similar standards applied to Grenada.
Well, Byron,
I have a right for that, you know.
The U.S. just announced that in order for you to come to the shores or to get even a visa, consideration for a visa, you have to show proof that you're vaccinated. And I'm certain a lot of Grenadians who like to fly up for Labor Day and other actions is going to get vaccinated to go to the U.S. They wouldn't do it for us and in Grenada, but they're going to do it for themselves to go to the U.S. for whatever reason, Labor Day and those other things taken into consideration, because that is now the new requirements. And we're going to do that without even thinking.
Senator Allie, you just said it, you know, you just said it. You just hit me like a light. They won't do it for us. You see, that's the dynamic in this pandemic. The fact that my action would help you and your action would help me, and together our collective actions will help each other.
That's right.
And having said that, we all get to the place of realization of what that is for the greater good by different measures, because we all don't understand things the same way. We're not at the same level as it relates to convictions, religious beliefs, you know, way of life, the way we were brought up, schooled, etc. And so that is why I said last week, and I keep saying, messaging, revaccinations, and so cannot be one size fits all. It really has to be strategized, structured, and delivered in a way that meets different groups of individuals where they are. There are people who are scared about vaccines, about needles, about anything entering their body. There's that group of individuals we need to pay attention to. The people who have dug themselves, their heels in, and they call them whatever. I don't even like to say it, right? So I won't even say it. because all I want to be called is Auntie Brenda, not Auntie nothing else. So those folks there who have dug their heels in and have decided they are not interested in this. And every time a group of doctors, young Grenadian professionals this Sunday, comes up to give science and facts and information, we find that the experts find themselves in the comments and they have no interest in the people who studied for 7 years, paid a lot of money, or the state sent them and got the science and the training to let us know what we need to do. Right? So we have all of that to contend with. We have groups of pockets of individuals, of this other overused word, stakeholders, right? So we have unions, we have churches, we have NGOs, we have all these people who have captive audiences. These are the sort of, everybody needs to now rise and lift. And there's this all the cynicism, well, they didn't include us before. And that's why I say I agree with Gaston Brown. That's the only thing I agree with him about last week, when he said that it has now become an excuse for folks to say things like, well, the government didn't include me, so what do they want me for now? Or for us to just say, well, I don't trust. Okay, you don't trust the vaccine, I get that. You don't trust the medicine, I get that. But this constant, we don't trust each other. Do you trust yourself? Where are we going with this? It is now time for us to find common ground. It is now time for us to, the human in us, to be empathetic. I mean, Saturday I was like down in the dumps with all these old people. Find it within you and how we can rise. We can rise. A time will come when we would adjudicate who didn't do right, who did right, who tried. That time will come. But for now, Grenada, we have a problem, and it's only us to fix it. Only us. Yes. All of us, every one of us, wherever we sit or stand. Yep. Anywho, this morning, we have a great show lined up for you. We have the Minister of Health in the wait, and we also have a conversation with 3 COVID survivors. Yes, we want to talk to people like ourselves, people like you who have had COVID in Grenada and are recovering, still afflicted, impacted, and we'll hear from them this morning in their words, in their experience, what they had. So we take a quick break and we come right back with our Minister for Health, the Honorable Nickolas Steele.
For persons with symptoms of COVID-19, testing is done within 5 days of the start of symptoms using a SARS-CoV-2 antigen test. If the result is positive, individuals are required to isolate for 14 days. Day 1 of isolation is the day of confirmation with a positive test. Retesting is not required for release from isolation. Once persons complete the required 14-day isolation, they can resume normal activities, observing routine public health protocols. If the result is negative, a PCR test will be done for confirmation. If the PCR test is positive, the individual is required to isolate for 14 days as above. If the PCR test is negative, the individual will be released from quarantine and can resume normal activities observing routine public health protocols.
Welcome back to Perspectives. It's a pleasure for us to introduce our Minister for Health, the Honorable Nickolas Steele. Good morning, Minister Steele.
Good morning, Brenda, and good morning to all of your viewers and listeners out there, and members of your panel.
Morning, Minister.
Morning.
Morning,
All
Minister.
right.
Morning.
So 4 Mondays in a row. It's now a full month since we since we're doing this every Monday morning, so that just kind of encapsulates the time really that we have been in this situation that we find ourselves in. So a third lockdown, a third no movement weekend, we just ended that. Anything you want to share with us on what you're garnering from those weekends, Minister, now that we've ended the third?
No, just to say that I think we are making progress. Regrettably, we are losing loved ones, and it didn't have to be, but we are where we are, and I think we all need to accept it and do our part. I think you were touching on that earlier, and we will get through this. We are seeing a light at the end of the tunnel, but we still all need to maintain the discipline that we've had. We still all need to be our brother's keepers. And we all, I think, need to regret the passing of some of our loved ones.
Indeed, indeed. Talking about light at the end of the tunnel, before we get to that final illumination, what sort of darkness would we have to traverse before we get there? 'Cause I'm asking a question to really ask. I mean, we're not out of the woods for sure. And what do you expect to happen in the next 7 to 14 days? What is the epidemiology saying? What are your people saying to you?
We are seeing that positivity rate is dropping. So therefore, the number of positive cases that we're finding out there is reducing significantly. Regrettably, though, the death rate lags behind that. As the science says, the death rate will lag behind that at 10 days to almost 14 days before we get to a point where what I think we all want to see is that people aren't dying. People aren't dying in the numbers because of COVID-19. And that, regrettably, is quite likely another 10 days before we see that happening, as long as we all keep doing what we've been doing. As long as we all keep doing what we've been doing, we will see that light at the end of the tunnel. But as you say, yes, there is a period of darkness before that.
Yeah, indeed. In terms of from last week to now, are you in a position to tell us how many tests were conducted?
We're doing approximately 1,500 to 2,000 tests per day. Per day. Over this weekend as well, with the multiple sites, I think it would have been most definitely close to 1,000. I haven't seen the full figures myself. I have seen the positive cases, so that sort of gives you puts it into perspective, to coin a word, as to where we are. But like I said, we are seeing those deaths still, and that will continue. We will continue testing, we will continue vaccinating, we will continue doing what is necessary, engaging those who are still yet undecided, engaging those who are still fearful of vaccines, and making sure that we get as many people as possible into that safety zone.
The unvaccinated and the fearful, what sort of messaging approach are you envisioning to give to them? Because we have to agree that it has to be different, and we want to get them to become part of the safety zone, as you just mentioned. So how are you going to be tackling the fearful and those who, are just a little concerned about certain things?
But I think it varies as to the source of the fear. Some individuals have a fear of the vaccine because they believe that an underlying condition that they have or may have may put them at risk in taking the vaccine. Other individuals have a fear of the vaccine because of the unknown, the science, not feeling comfortable with it. So there are different approaches. So it truly does depend on the individual. For those with the underlying conditions, it is to understand what the underlying condition is and to address it directly. Have one of our doctors or nurses that they trust address it directly. If it is for those with the lack of trust with the science, it's a little harder, but not impossible. It is to provide them with the information, because most of them want to do their own research. So those are the two main variations we're seeing. of individuals. And then we have some who are, they would say, like some did yesterday to me, I'm just not ready yet. And we're trying to convince them that please don't wait until it's too late.
Yeah. Senator Allie?
The other thing, Minister, of waiting and waiting to see is that if you do become positive in that wait and see, you have to wait almost 3 months thereafter to be vaccinated, which puts...
Provided that you survive, Chris.
That's right, provided that you survive. And of course, you put yourself at risk for what we call a long haulers disease of some issue developing within your system down the road. And that is something I think a lot of us don't consider as we sit and wait and say we're still waiting to see. Well, my question to you this morning, Minister, is going to be along the business part. As you know, most businesses for this week is going to be 4 weeks out that have not been given the permission to open and operate because they're termed non-essential. So the question is there going to be some consideration of relief for businesses in the next week as we go forward and we see at least the curve trending in the right direction, flattening and heading south? So is there some consideration that's going to be given for business entities to reopen to some degree?
2 parts on that. There has to be. We cannot remain closed indefinitely. But we have to put lives first. And based on the current trajectory, we are seeing that as a possibility in the not too distant future once we keep that trajectory. We have to be very careful. We all know of other countries and other examples of easing too soon and creating a further increase or a second wave, so to speak. So we're cognizant of all of these things and have to take everything into consideration. And for sure, I know that there are many businesses out there that while they may be in the group called non-essential, businesses are essential to the business owner and the employees that are there. That's how they make their living. So yes, we have to find ways to do this and to do this as soon as is possible and practical.
And a related question, Minister, you would have noticed, I'm sure you would have heard, Trinidad's new approach to livelihoods and businesses, and they indicating from 11th or the 10th of October thereabout, they would allow opening of certain businesses, hairdressers, bars, theaters, and so on and so forth, on the condition that you are vaccinated and that, of course, you could observe the protocols. Would that be a consideration of the committee and cabinet going forward, that as we look to phase this opening of businesses, because the behavior is the key thing here now that we have community spread, would there be consideration of us looking at having partial opening of these businesses for in-phase dining, say in a restaurant, if you are vaccinated?
Well, I think that the science is clear that fully vaccinated persons are better protected and stand less of a chance of catching or spreading the virus. And therefore, the number of persons fully vaccinated has to be taken into account. In an industry, we have done so already here in Grenada with respect to the hospitality industry and being quarantine sites. So it is not a discussion that we have not had here in Grenada, but it is a discussion that we do need to have over the next week and some as we contemplate our reopening.
And my last question for you is, again, I've been a proponent of mandatory vaccinations in some quarters. Again, is that going to be a consideration? So, for example, homes and places where we have shut-ins, the mental home, for example, are we going to consider this as a government that we need to mandate vaccination, if not for the residents, but at least for the staff who operate in these homes and so on, because we know what can happen in these homes if we get a spread. There could be a massive, quick spreading because of the shut-in nature. Are we going to consider some level of mandating of the vaccination for facilities like that?
Chris, I truly do believe that and hope that we don't have to get there, that common sense will prevail, that the practical, unfortunate examples of the last couple of weeks will serve as rude awakenings, painful awakenings to all of those involved in certain industries.
Right, Byron?
Yeah, morning. Thank you, Chris. Morning, Minister Steele. How are you? Greetings.
Greetings, Byron.
And again, just want to compliment you and the entire ministry for the very important work that is taking place. I want to make a comment on the general numbers going forward, Minister. From the last update yesterday given, we noted that there are some 93,700 Grenadians eligible for vaccination, for vaccines, and first dose is some 34,000. But the information says about 24% vaccinated. But if I look at the percentage of the population who've had their first dose, that comes to about 36%. So I'm saying this is pretty good in my view. It means that if you took a first dose, then you're likely to take a second dose. So we're looking at potentially here as we speak about 36%. So I think that's a very, very positive direction, very positive uptake. Soon I will say, I speculate we will be up to 50. But I want to elaborate on a question that Chris talked about in terms of the formulation of a policy as we manage the wave now, the crisis now. To what extent the government is thinking about a formulation of a comprehensive COVID-19 policy in terms of going forward, in terms of safe zones, in terms of we've seen different countries have taken an approach, whether it's Europe and other countries in the Caribbean. Is the government thinking about a holistic approach to this? I don't believe that, as you mentioned, common sense will prevail. We can't depend on common sense here. Common sense did not prevail in August when we had persons had their own carnival. It has to be law. It has to be mandated, in my view. But can we expect an overall comprehensive policy on managing COVID-19 going forward, Minister?
Look, Byron, that's the key question. And you use the phrase common sense prevailing and also about mandating. We can't legislate ourselves out of this. August is a prime example of that. The regulations did say there should be no gatherings of the type that we saw. So it's not just simply a case of passing rules. That's one clear lesson to me of this. It has to be a collective response. So therefore, Byron, yes, it has to be common sense having to prevail collectively. If not, we can't do this by legislation, and the few cannot lead or protect the many.
Mr. Campbell?
Yeah, look, my follow-up thing would be here, but you see, there must be consequences, for persons who refuse to follow common sense, and it cannot be like business as usual. Consequences in the sense that we've seen in some territories that, look, you don't comply, then the consequence might be your job. The consequence might be some other thing, a convenience or something like that. In other words, and the other point I want to make is that and this bothers me a lot, the amount of misinformation and rubbish, frankly, that are so much on social media and elsewhere, and even local media sometimes. And how do we counter that? How do we manage this, really, if it's manageable at all?
That's one of the most difficult parts. Respecting the freedoms and the rights of individuals, freedom of expression, and where you see some of those individuals exercising their right to express themselves, putting out stuff that's truly misleading people, and actually putting persons' lives at risk. It is a difficult issue to deal with, and it's not a Grenadian issue alone. It's being dealt with throughout the world. It's being dealt with in all different countries. So it is something.
I just want to also congratulate your ministry. for opening the health center at Grove to serve the parish of St. John's and St. Mark's in terms of vaccination and testing. I think that's a good thing, sir.
Yeah, well, thank you. And the team that is responsible for that is a combined team of the Ministry of Health and SGU WINREF. So it's a combined effort.
Minister, we're noticing now in nations around the world, the US in particular, that they're getting tired with the people who sitting on the fence. And they're now putting in rules, laws, regulations. So the US just recently said that, for you to enter the US, you must prove that you're vaccinated. Plus other things. I mean, you have to show a negative PCR test within a certain time frame. Is that something that as we look in the Caribbean and the OECS as a sub-region, we're going to see more and more governments considering this as we move forward?
Well, Chris, we've already done that here in Grenada.
Yes, I know that.
To enter Grenada, you have to be fully vaccinated, or unless you are a citizen, because we do believe that our citizens have a right to return regardless. But yeah, you will see countries getting putting in more and more regulations to protect themselves, because like I'm getting from your tone and from Byron's and from Brenda, people are getting, as you said, fed up or frustrated.
Mm-hmm.
Yep.
It is a tiring situation, Minister, as
It
you know.
is.
For all of us who have been promoting the cause that you need to get vaccinated, we are on a precipice, and now we have fallen over, and we have in the dire consequences of 120 people dying in such a short space of time. As you said, we didn't have to be there, but we're there, and we have to move ahead. But going ahead, this new normal of living with COVID, I was reading a recent article that says it's going to be around with us for the next 5 or 6 years, and we have to learn to live with it and do all the things that's necessary to protect ourselves. Hence my trend this morning about vaccinated and unvaccinated. And, yes, it's going to create some separation, but I believe that as we go forward, this is the way we'll have to go. What is your thoughts on that?
The challenge for this government and any other government is to find that solution without dividing the country or without further dividing the country.
Right.
We need to bring our people together in order to get there.
Yeah.
I agree.
I may be sounding idealistic, and it is an idealistic point of view, but we also need to recognize that this is a democracy, and that August has taught us if we do not convince the majority, then we will not get to where we would like to, and we will not be in that safe zone.
Right. Well put, because we do need all of our people to get what we're trying to achieve in trying to get the greater good and trying to get to the levels of safety that, scientifically and ideologically, really, we need everyone, no matter where they sit, how they feel, what their convictions are. Having said that, though, yes, Minister, we're sounding tired and not tired as being tired, because we're well rested for having, no movement. But
I'm so sure about that.
the thing is, it is as you think and you dig, because we find ourselves in a place now, and I'm sure a lot of this are coming to you, so this is coming to where you're at, so it won't be new, that people are really struggling mentally and in all other forms to try to adapt and to cope and to hope we'll get out of it. And then we see, there's a majority of us that still think, well, I need to wait. So then we who have progressed a bit have to wait on those. So, it's like a relay where you're kind of waiting for the baton to come through. And yes, it could be a fatigue, so to speak. But if we feel like that, I can imagine how you feel, and how the cabinet feels, and how the healthcare professionals feel, and how the epidemiologists who really understand this more than the rest of us, how they feel, and the sort of measures they tried and the things they tried to put in place to get us to understand. So it is the whole level of all of that we now find, all of us just find ourselves at a place of fatigue, you know. So coming up this week, another no movement. So going forward, Minister, before we let you go, to plan all those important things you need to plan, whether we stay inside for a while still, while we let whatever's roaming roam, or what we're going to do, or is there anything you can tell us as to what we can expect in the coming 14 days or so?
And let us hope that the next couple of days, several days, start showing us or continue to show us positive trends, and taking us in the right direction, so that we can contemplate getting back to some sort of normality. Those positive trends are going to be seeing the number of positive cases declining as a ratio of tests, seeing the number of vaccinated persons increasing as a percentage of our population, and most definitely seeing the number of deaths halting, hopefully, but most definitely for them to be significantly reduced. Those are what I look forward to seeing in the next several days. We're beginning to see that trajectory, and I hope that continues. If that continues, then I think we all understand that with that, we can contemplate a new norm, an easement of some form or fashion.
Okay. And are we at a satisfactory place as it relates to medical supplies, testing supplies, you know, the hospital, things running satisfactorily there?
Things are running, and the individuals there need to be truly recognized. Yeah. The human service that they are providing, the system has been stressed to the max. It has not broken us. We still are pushing forward. As to whether it is possible to break the system, yes, it is. If this were to continue, the healthcare workers have been producing and working at a superhuman level, but they are not superhuman. They are human themselves, and there's only so much that they can give. They're giving sweat and blood, literally. But there's only so much they can give. So we all need to recognize them, and we all need to hope that this comes to an end as quickly as possible, so that they can exhale, so that they can breathe as well.
I know last week when you were here, just before we let you go, I know last week when you were here, you mentioned that some help was on the way. How have that help integrated, and have, you know, some of the individuals, have they been able to just breathe just a little bit?
Yes, that has made a big difference. We've had a 5-man ICU team from Mexico. We've had a delegation led by Dr. Philip Bonaparte. And yesterday, Claire and Hare is a daughter of the soil, Dr. Karina David, is here as well, lending her hand. And we have individuals that are coming in from SGU alumni as well. We have persons abroad doing their part. Dr. Lisa Radix, Michelle Friday, Kester has been all doing, Kester Ned, all doing their part, providing human service and really helping to ease the tremendous pressure that the health system has been under.
Yeah, and we noticed that we've had doctors in the diaspora doing education, information, and training on Zoom calls last Sunday and this one as well. So definitely, yes. You know, really, and lots of Grenadians all over the US, England, and even in some parts of the Caribbean, you know, they are making, you know, raising these efforts to send supplies home. So that certainly is going. Notice you didn't say you didn't answer to satisfactory at all as to what was happening, but I understand, and thank you for helping us to understand how tough it is, and that we have to just keep putting one foot in front of the other as we try to get out of this. Thank you very much, Minister. Your parting words?
Thank you. And parting words, just simply to thank all of those who came out over the weekend, especially and in particular, those who gave up their time, medical personnel, as well as non-medical personnel who helped register and ensure that persons got tested and vaccinated all over the country. I really want to thank them, and they are some of our new heroes in this battle, and it is because of them as well that we are getting through this. So I want to thank them all, and I thank you and Chris and Byron always for the time, and members of the public for making the continued sacrifice that will get us out. Thank you.
Indeed. Thank you very much, Minister. Try your best to stay above the water as best as you can, to you and your family, and indeed all our heroes on the front lines here in Grenada, and those who are fighting the battle for us on the outside as well. Thank you so much. Have a good day.
Thank you. Take care.
Okay, bye-bye. We take a quick break. When we come back, we talk to 3 COVID survivors here in Grenada. We'll be right back. Don't leave. Good morning, everyone. Well, welcome back to Perspectives. Yes, still morning. We're having quite a long one with you this morning. This part of the program gives me great pleasure to introduce 3 Grenadians, Fabian Charles, Roger Duncan, and Fabian T.C. Charles. For those of you who are wondering who is Fabian Charles, Roger Duncan and Sherry Robertson. And they are 3 Grenadians, different walks of life, who are COVID survivors, and they're here to tell us their story this morning. Good morning, lady and gentlemen. Good morning.
Good morning, everybody.
Morning, good morning, good morning, good morning, everyone. TC, good morning.
Hey, good morning, guys.
Good. So, if you gentlemen will acquiesce, we start with the lady first. Sherry, tell us about your COVID experience.
Well, first off, it was a bit scary. When I first got a bit sick, like I was feeling when you get the flu, a little scratchy throat, my nose was running a bit, but I said, you know what, let me get tested first just to be sure. So I reached out to about 3 health centers, and I didn't get through with 2, and one indicated that I can isolate over the weekend and then come back to them on Monday. But I relayed the info to my brother, who's a nurse, and he went ahead and found out that there was a free clinic on Saturday. So I went to the free clinic on Saturday, got the test done, and realized that I was positive. Well, then, anxiety kicked in, depression, everything one time. Because the thing I was most fearful of is ending up in the hospital, dying like some of my friends did. That was my main fear. But when I got back home, everybody in my household, they tested, they were negative, thank God. And after that, I basically isolated in a room in the house. And with the help and advice from my brother and my significant other, I'm here today. My brother advised me, to use the vitamin C, the zinc. We also did like home remedies, to basically keep the fever down, because the fever, the aches, and the pain was the worst.
Yeah.
I mean, I had chikungunya, but chikungunya cannot compare to this. But I'm here.
Yeah.
I'm here. A bit tired still. The fatigue is still there, and I'm not able to taste yet or really smell. Like it has to be like a strong perfume or something that I can smell. Yeah. But I'm here.
Sherry, we're so happy to have you here. So happy to have you here. As many of our brothers and sisters, as we very well know, and friends of yours, did not make it. So we're happy to have you here. Roger Duncan, good morning.
Good morning, Brenda. Good morning to your listeners and viewers.
Yeah. So tell us about your COVID experience, or your interesting experience.
My experience has been very unique. My wife, who's a pharmacist, was tested positive a Thursday evening. And on my way home, she called to say, this is the case. And then, immediately I informed my immediate co-workers, those that isn't my immediate surroundings, that is, inform the folks home as to what's happening, some family members and friends. And so, got home, the children was extremely fearful. They had a hands-off, standoff position. So the stigmatization started almost immediately. But understandably, that is. And then we immediately had to kick in some protocols at home, basically the same as what exists now, wearing our face masks and social distancing and so on, until a PCR test could have been conducted. Because the test that my wife did was a rapid test. A couple days after, the nurses came to her home, did the PCR test. And interestingly, my wife remained positive, and everyone else, including myself, was negative. And while she has been positive with very mild symptoms, I have experienced all of the symptoms of COVID having a negative result, interestingly.
Wow.
And I had the first dose of the AstraZeneca 3 weeks before that. At home, you treat teenagers, and there's a senior citizen, my mother-in-law, who is in a very senior age here too as well. And my children had to step up to the game, especially my son, who is 19 years old, caring for his grandmother, cooking, making breakfast, as best as he can, lifting out of a bed, turning her, bringing her to the washroom. He has gone through a serious transition during this time, and he lost a dear friend of his too at Cece, the young girl, Rihanna, who he had been close to. And I recall one night he knocked my bedroom door about 20 past 11 at night, complaining that he couldn't breathe. And I thought, I got scared right away, but I know that he was tested negative. And I could see that like he's trying to say something in the process, you know. And I knew he was hurt. So, you know, I just said, no, boy, cry, you know, let it out. And he cried for hours, vomited. It was real painful for him, losing that friend. And reality really struck us, you know. Interestingly, I have been hesitant in taking the vaccine months before, you know, had the same wait and see approach, you know, it's nothing crucial yet. Things get dicey, as we'll see, I'll probably take it and so on. And then during that process, you get bombarded with all sorts of information. I think what is important for persons, as I've come to the reality before taking the vaccine, that we owe ourselves the personal responsibility to read on our own and try to be very objective. And I'll tell you, in going to the stadium to get vaccinated, I'll tell you what was the final kill for me. You listen to the conspiracy theorists and so on, and you know, you get all this thing about the immune system, natural immune system being able to work on its own. You have all the different remedies and so on. Then you get the spiritual side of things too as well. And I think of the virus as this, you know, this is possibly man-made, right? And this is like a gun. Somebody just shot a bullet into me. That's not natural. That process was man-made. Somebody pulled that trigger. And that will require some man-made intervention to save my life.
Right.
The immune system, you could leave the bullet there and the immune system might help over time, or it may not. But I came to the reality that I needed man-made intervention for a man-made virus. That was my interpretation of it. And I said, you know what? I'm going to take this vaccine. And then I think of so many men, especially who do not even know of the current health status. I have a lot of friends who have not ever taken a health check, the annual health checks and so on. And you know, and they are anti-vaccine. And surprisingly, I would not be surprised if many of them requires other type of vaccine after they would have taken the health check. And they would, because at that point you realize, look, you have to trust the system. And a lot of us as parents especially, we invest in our children. We spend hundreds of thousands of dollars for them to pursue studies in medical fields and so on, right? Are we saying that this investment is a waste? And some of us who have gone into the medical field, being the scientists themselves, medical doctors, are we saying they're all heathens? They're not Christians too? Right. So we really have to look at this thing objectively. We have to stop listening to what he says, she says. While it may have some value, right? We have to really read. I'm not sure how much of us are reading. I know a lot of us are swiping. We spend a lot of our time every day just swiping up on the phone, swiping down. Yeah. And our heads are down, and we have not really figuratively lift our heads to understand what is happening before us. This is real. Yeah. Life is not, a rehearsal. It is the real thing, right? We're not practicing this thing here, right? So, the isolation home was tough. Managing it was tough. Luckily, given, the career field that I am in, I was able to have something set up, and I want to encourage people to do that too as well, where I was able to utilize my e-banking and transfer monies to friends who were able to shop and bring items home for me, drop it off at the gate, and off they go. I'm only communicating to them via phone, and then I pick it up. I've had some friends who were able to bring them the coconut water and all these sorts of things. So I was able to manage that way. And as well, you would want to at home. I'm speaking to parents too. You want to empower your children too, right? Get them involved in family affairs. So when you have to respond to situations like that and emergencies, I think, the children will be more capable the expectations and the roles will be clearer, and they'll be able to handle and manage stuff. I mean, my own did a pretty good job, and it's because we had them involved. And I could tell you, they have force matured overnight. It's not the same children that I know last month, you know. So as it stands, by October 6th, all of the household will be fully vaccinated. I mean, the biggest scare really was just not knowing what would happen to us. So while I experienced all the high fever, everything just tasted strange in my mouth. I did not lose the smell. Headaches, my blood pressure was doing some funny things, and that's the thing too. We spend a lot of time investing in a lot of gadgets and so on, right? You want to be sure as a person who care for your health, which you should. You care for your vehicle, you underwash it, you do engine wash, you do regular checkup, that you have critical equipment at your home, your blood pressure machine, your glucose machine, your oximeter. You need to have those things. And maybe we should start buying these kind of things for gifts for friends, because probably they won't go buy it on their own. So I was able to monitor those things, while I was experiencing all those symptoms. So I know what was happening. Having spoken to some persons in the medical field in recent times, I think everyone is convinced that the first shot of the AstraZeneca that I took 3 weeks before I got ill really gave me a fighting chance. Mm-hmm. And this is what it's all about. You know, you want to give yourself a fighting chance for something was likely man-made, and you need man-made intervention, right? The immune system may work, but it's probably over time. It's not going to kick in at the rate that you expect it to kick in when you have something destroying you at the rate 100% effective rate immediately as it gets in, right? You need that buffer, that cushion of something in you that will help, right? Indeed. That will give you a fighting chance. This is how we looked at it as a family.
Good.
And exactly what we did.
Great. Senator Allie?
Question for Sherry. Sherry, were you vaccinated before you got COVID?
I happen to have gotten my first shot of the Pfizer. Mm-hmm. So I think that really helped to not have me end up, because I have sinus really bad and migraine. So I think that first shot of the Pfizer, it really helped. Like Mr. Duncan said, I was a bit hesitant when the vaccine first came out. So that is why it took me so long. I got the first shot was on August 25th, and I was supposed to get the second shot on the 15th of September. So now, as the doctor advised, I have to wait about a month before I can take the second shot.
Right.
So, yeah.
Thanks for that.
My fingers crossed and nothing happens before that.
Absolutely.
I think the common thread listening to Roger and yourself is that, being vaccinated significantly helped you guys manage your symptoms. And listening to Mr. Duncan and the trials he have been through with his family, I think that is something we tend to ignore. Yeah. The effect on not just you, the individual, but on the people closest to you and the family in your immediate surroundings. And that is why COVID, I think, is showing us, listening to you guys, that, you're not doing this for yourself primarily. Yes, you need to protect yourself. If you're a main breadwinner, you're the head of your home, yourself and your wife, you need to see about your home and yourself. But this is more about the people around us. I don't think any parent, listening to Roger and how his children was forced mature during this experience, I don't think any one of us wants to come home based on where we are and what we do in our daily work life and so on, and bring it to our homes and affect people that we care deeply about and love the most. And, even though you don't do it for yourself, but what about your children and your wife and so on? And I think when we listening to you guys and hearing that experience brings it home to me, at least, that if I don't get vaccinated for myself, but at least do something that will help the ones closest to you and you care the most about. You know, in the Bible, they say if you really want to get at somebody, deal with the children, not you. It affects you worse if it comes to the children. And, you know, it just, this COVID disease is clearly bringing those things home. And I am listening to you guys. I hope the rest of the public hearing, you will say to, you know what, this is not about me. This is about others as well. Let me go and get vaccinated, because yes, there is local remedies. Yes, local remedies have worked for us for many years as island people. You know, and our people have handed on very good remedies. But as Roger is saying, if this is man-made, then you need probably a man-made intervention to deal with it.
That's
and that's an interesting way of looking at it.
Very
and you know, I have nothing wrong. I have no objections to people boosting their immune system. But I believe at the end of the day, even your own immune system needs help. That's why they're telling you take zinc and take all these multivitamins to help the immune system. The vaccine is a help. And I see it as simple as that. So Roger, I mean, kudos to you. I think you have done well to manage. And I know all of us in business and our own normal lives, you know, COVID has added another layer of challenges and management that we just never, you know, predicted would come, and the challenges that come with it.
It really impacts people differently. And we have another guest standing by. We say good morning to Fabian Charles, Fabian TC Charles. I know a lot of people don't even know TC name is Fabian. All they know is TC. TC, good morning.
Morning, Brenda, and thanks to you that know it now.
Good morning, my brother. How are you?
TC, how are you?
I'm good, guys. I'm good. Good to have me.
Good. Yeah, it's really good to have you as well.
From hearing the two speakers, I realized my role here this morning, you know, in this. I basically, I was here, and I was telling Brenda, I don't want to be politically correct. I don't want to be honest. I just feel people are idiots, and they are very hypocrite, you know, in terms of the vaccine. Make no mistake, I am vaccinated fully. Because I told them guys when we laughing, I actually went to cricket and you had to be fully vaccinated to go to cricket. Right. I went to cricket, so I'm fully vaccinated. But I got COVID, and I got COVID from the last place I expected to get COVID, which was my employment. Right. Because I was doing everything I think I was doing right. I was frequenting other places like bars and recreation places and things like that. But I'm following the protocol, and I would think I was the exposed mode there. But we had that issue maybe on work, and then I guess in terms of who he was working, manpower shortage, my immune system might have dropped. Right. And then I got COVID. Yeah. So I was shocked, but I wasn't really shocked because I thought, hey, I'm vaccinated. How the hell that happened? But then I understand how it would happen. Yeah. But it wasn't an experience I liked, and an experience I would wish on other people. But as I said, if the people are not vaccinated, I'm not going to be sympathetic with them for catching COVID. I think it's your right to not be vaccinated. You do what you have to do. But it's my right to not be sympathetic to you if I hear or see a picture on Facebook or wherever you guys posting it, and they say, hey, this person got it and they're not vaccinated. I can say, okay, that was a choice they make. And I think we are big enough to do that. Yeah. You know, and when I say that some of the people are hypocrite, I'm telling you that I do not trust the vaccine. I have my doubts, but I think I needed to take the vaccine, but I needed to protect myself and my family and people close to me and people I work with.
Absolutely.
So I did that.
Absolutely.
But TC, how have been your symptoms? How have been your symptoms since you got COVID? What symptoms you experienced? Mm-hmm. And I am assuming that you did not get severely ill that you had to go to hospital.
No, that was great. I have gotten, the first thing I got was a cough. And the cough started, I think, like on the 8th or so of September. I was coughing and I'd say, well, maybe I'm getting a cold. And the cough keep coming. And then 3 days after the cough, I had a fever one night. I was in bed and then I woke up like I was underwater and freezing. I was shaking like hell. I could actually feel my internal organs actually shaking when I was trembling with the cold. Right? And that lasted like for 40 seconds to a minute and a half. And then you started to feel hot again, so you had to put on a fan or AC, whatever I had. And then in the morning I woke up, I was kind of okay. And then I went to the bathroom and I got ready for work. And I couldn't smell my perfume on my roller. And I said, what the hell is that? I said, don't tell me this perfume spoiled. So I'm putting it right by my nose, actually right by my nose. and I'm spraying it on my top lip. And I said, what? I'm not smelling this. But I didn't really think of it as COVID as yet because, like I said, I was functioning. I didn't feel no joint pain. And all I had was a cough. And then I went to work, and then I started to feel fatigue, and then I left and I went home. And then I started self-diagnosing, and then I called one of my doctor friends, and I said, hey, I just actually can't taste now. So I can't smell, I can't taste. And I had fever last night. And they said, hey, man, you have COVID, try to isolate. And then I basically self-isolated. And then I got diarrhea for 2 days because I couldn't eat because anything I put in my mouth had no taste. So I was just doing liquid and melon and banana and things like that, which I had taste was sweet. And everything else I taste was tasting really, really salty.
Interesting.
So I was done in terms of fatigue-wise. I felt like I was carrying 2 bags of cement each time I get up to walk around the house.
Right.
I was like carrying 2 bags of cement on my back.
And how long that lasted with you, TC?
Yeah, and then came the breathing, because that was the last thing that came. Breathing part, the way that I couldn't take a diver's breath, as you would call it, a deep breath where you would fill the capacity of your lungs. I couldn't do that. I only could take like short, small, like a burst, like just small. Because if I went deeper than that, I felt like there was somebody in my chest with a knife trying to puncture my lungs. So I only could take short inhalation of air. And that lasts for at least 6 days. The fever lasted about 4 days. The diarrhea lasted 2 days. But the pain and the fatigue lasted about 6 days. And then I started the smell came back gradually, the taste came back gradually. And then after that, I could eat and digest good food. But then the last thing, after about 2 weeks, I would say a week and a half, is the lungs capacity to take a deep breath is the last thing that came back. So now I'm talking to you guys. I could actually take a deep breath and not feel any pain in my chest or my lungs, which is a great thing to have.
Good.
You know, TC, listening to your experience, a lot of people would say, oh, look at this man, he was fully vaccinated, he got COVID, and what is the sense to get vaccinated? What would you say to people like that?
Well, I would tell them that if they're not vaccinated, they're not going to be looking like me, they're going to die. That's what I'm going to tell them. Because I was just lucky. And I think Grenadians had this misconception because we have one of the youngest population in the Caribbean. We are healthy. We are not healthy. We are just blind to the fact that we're young and we feel we're healthy. We have a lot of underlying issues that we don't even know we have. We have like a pantry of illness. We have diabetes. We have high blood pressure. We have sugar. You know, we have cholesterol. We have sickle cells. And all these other young people have. So when you see that they get COVID, that's why most of them die. And we are shocked when COVID killed. COVID killed them because they have issues that they didn't even know they have. All they might think they have, the blood pressure might be high sometimes. But when you go to a doctor and do a real test, they have so many other things. So when COVID hit them so hard is that they don't survive it. Yeah. So if they can say, oh, TC is vaccinated and he catch COVID, so why should I take the vaccine? Tell them TC say, hey, they don't have to take the vaccine. But that they might die if they get COVID. They wouldn't be lucky as other people in terms of recovering.
Right.
Yeah.
TC, do you feel anything anything you probably would have done in your life, like any sort of activity, the way you eat, or any extracurricular activity, anything would have helped you through this period? Because like I know you dive. So do you think that deep diving experience where you really had to use your lungs, expand and contract, do you think that helped you in this fight with COVID?
Yeah, definitely I would say that. I think the lungs exercises and the diving has actually grown your lungs to take the strain of the COVID. And I think that's one of the reasons that I didn't have much of a lungs issue, only what I mentioned. I must say that. And I think I have invested in a lot of things over the years, but I think one of the biggest investments I have made is the one I made in myself when I took the vaccine. I must say that. And I was giving them guys a joke, calling on them. I think the biggest investment I did last year, of all the investment I made, was just going to the stadium and take the vaccine.
Right. You mentioned that you didn't trust the vaccine and all of that. Talk to us about your not trusting level and what led you to getting the vaccine.
But I must say you would be naive if you don't have some sort of mistrust with pharmaceutical products and pharmaceutical big companies, because there are always some kind of thing we need these things. So there is going to be that mistrust, but at some point in time, you have to talk to the right people, talk to your physician, your doctor, get your own information, not sitting down in the toilet or in the car and they're on your phone and getting messages from this group and that group and people sending shit like that. Thinking about there's been a contrast where you do some self-investigation and make decision for your own health. Yeah. Right? But as I said, I think there would be mistrust. There's going to be mistrust in the government and there would be mistrust in the pharmaceuticals because there is a motive that we don't know what their motives are. But as I said, I think the people who are using that as an excuse are hypocrites because as I said, and I keep saying that you can't remember the first time you took your roll-on. Brenda, you've been taking roll-on since you might be 9 or 10 years. And I actually know, Brenda, could you give me one ingredient on the roll-on and the side effect?
True.
Brenda, could you give me?
No, I can't.
I just want to come in here a little bit. Listening to the testimonials, the testimonies from Roger and Sherry and TC, I mean, it's just amazing. But before I go into this, TC made a point there about the health of Grenadians, and I just want to grab some information there that our life expectancy is about 72.4 years. And non-communicable diseases contribute to the leading cause of death in Grenada, and this is from the WHO. And the non-communicable diseases such as cardiovascular diseases, cancer, and diabetes constitute for the majority of premature deaths in Grenada. And cardiovascular disease alone contribute 32%, about a third of all premature death, and were the leading cause of death in Grenada in 2016, not too long ago. So that says something about our health overall, and we have a long way to go. And certainly COVID here is not going to help at all. And how do we improve our immune system and our health overall? But listening to the testimonies, is really it's an important lesson. We need to hear more of that. I hear about the anxiety and the depression that comes with it, as Sherry indicated. But I think what's important there, and I think this came from Roger, is the family growth and the youth, how our young people, and this is one of the experience, have been affected by this new experiences with their friends dying in school, and how the family is strengthened when they are thrown into areas of greater responsibility. And another important point in terms of what we invest in, TC spoke about, I think it was Roger or TC, about the oxygenator or blood pressure machine. These are small gadgets that are not expensive, and it would make a lot of sense obtaining some of these. But I'm just moved really by the testimonies, and I just want to wish you all well. And we should be listening to more of this. Thank you very much.
I just wanted to ask, I want all three of you to chime in on this. Roger mentioned that as soon as the children heard he had COVID, the stigma first came from home. Have any of you experienced that in any way, shape, or form? And just generally, I mean, what would you want to tell anybody as to why we should not stigmatize COVID? Sherry, I'll start with you. Sherry?
She's probably not there. Just do TCN.
I think she might have dropped off the call.
I was muted.
Oh, you were. Sorry. Go ahead.
Yes. Well, COVID is not a death sentence. It's not HIV, cancer. It's not a death sentence. There's a lot of things that you can do if you catch COVID to recover, right? So the stigma that people have, like they con you. Some people believe, oh, if you have COVID, you can't be around you because, I might catch it and so on. My household was around me for all the days, and they're still negative, right? It's all about the safety measures and the protocols that you put in place to run your household if you have COVID. Yeah.
Right.
That's what.
So you felt loved and you felt supported by your family members.
Yes, I did.
And that was important for you, right?
Yes, it was. It was, because without that, trust me, the anxiety and the depression, it could put you out.
Yeah.
If you don't have that support. And sometimes, you feel like, oh my God, I'm going to die, or I'm going to end up in the hospital. I didn't expect to get this. You think a lot of negative things, but when you have that support, that mental support from your family, it helps a lot. It does.
That's great. Happy to hear that. And then you're fortunate enough to have a brother who is a nurse. TC, any stigmatization or anything? How are poor folks treating you?
Well, I had no problem. I don't know if I had people had stigma, people talk behind my back, but I didn't care. But I have a great circle of friends. So when I reach out and told them that, hey, I am positive with COVID, I had to tell them, hey, stop calling and asking, stop calling and see if I'm good.
I see. So you good? Something happened, TC? TC, I think you mute yourself in error.
Oh, maybe I did.
Yes.
Yeah,
right.
Yeah.
So you see,
I had a good circle of friends, a good support team, and I was okay. My job was just for me to psychologically put myself in a frame of mind to get healthy and be back out and running, and look, I'm having this conversation with you guys now.
Yeah. Did fear creep in at any time? And at any time, did you become fearful?
Yeah, definitely. At first I was okay. I was walking through everything. It's then when I had the problem having the deep breaths, that's when I started to basically overthink everything, and that's when I was kind of fearful. I was saying, okay, no, it's reaching my lungs, and this could be happening. There's going to be this going to be. Then I have to go to the hospital. Oh my God, this is bullshit. This is going to be happening. Yeah. That's when the fear came, when I had the lungs issue, where I couldn't take a deep breath.
Right.
But then I walked through that myself. You know the 5 stages. I went through the 5 stages, and then after, as I said, it came back gradually where I could actually take a deep breath. And then Saturday I went and get tested, and I met Mr. Steele, and we had this conversation. We had to laugh, and I was tested negative.
Okay, good.
What about the mental side of it, TC, and the others? What about the mental side of this disease? What kind of strain, emotionally and mentally, did it put on you when you tested positive?
No, I'm going to answer that too. I think it all depends on the individual and his circle in terms of where he works and the support he has and his family and friends. Everybody will have to deal with it differently. For me, it was basically I was okay, as I said, and then until I had the doubts when my lungs started to hurt, that okay, this could be worse, this could be it. Because like I said, I have underlying issues too. I have hypertension, and I tried monitoring that. So all this was going through my mind. But it is a strain on you mentally, and it depends on how strong the individual is mentally, no matter the support he has. So people could fake when all the support they have. Oh yes, I'm good. Yes, I'm going to be okay. And as you put on the phone and you go up the face talk, you're crying and your depression is there and things like that. So it comes down to the individual. Yeah. First of all, he or she has had that mental capacity to support his own or her own self in the time of COVID or any other illnesses. Because these people can't talk to you for the whole night, the whole day. They have to go. But there is that time in truth where you feel that depression and you feel that, hey, this could be it. This could be what takes me out of the earth. This COVID could be the one that does that.
Yeah.
Well, I want to thank you guys for that testimony. I really hope that will convince some of us who are still on the fence and still hesitant that, one of the solutions offered to us is vaccination. And the quicker we make that decision, probably the better we could protect not just ourselves, but the one that we care most about around us. So thank you guys.
Yes, indeed. Just want to hear from 3 of you, just your final words before the, but Roger, something you said stuck in my head. You said you tested negative, but you had all the symptoms of COVID. Has that been explained to you scientifically? Because that's interesting.
No, some of the possibilities that were brought forth was maybe at the time of the PCR test, the viral load was not strong enough. Maybe it could have been a faulty test, but certainly everyone believes that the first dose of the AstraZeneca that I had 3 weeks before certainly helped in some way or the other. Because I believe there's a strong efficacy or the first dose.
Yes.
I don't know what's the percentage, but there's a reasonably strong efficacy on the first dose of the AstraZeneca. And then of course there was the other explanation, no pun intended, that sometimes in a marriage one person has to bear the brunt of things at times.
Yes, well, I don't think wifey would like to hear that part.
Well, Roger, till death do us part, they have to support in every way. You have to carry the load, you have to share everything. Good husband you are.
I just want to also add quickly with respect to the stigmatization. When I live in a by road that is about 200 meters in length, so I do a lot of physical activity, walking and so on. And I can recall the first time I went out doing some walking after I felt much better. I met some of the neighbors on the road walking too as well. And after a turn, the first turn to come back again, everybody disappeared. There was nobody walking anymore.
Really?
Like, this news spread so fast, right? Already.
Really?
But the other thing is that I know of some people who were positive then, and I've gone into the supermarket and I've seen them shopping.
Yeah.
Right? So while there would have been some measure of scorn to me, you really don't know who's around you and who hasn't.
That's it. That's it.
And when I went back to work, I mean, my team around me has been very supportive and so on. But in understanding the stigmatization, I helped in the process too as well. So I went back to work and I had a face mask and a face shield, just so to give the perception to the others that, okay, I'm really enclosed and protecting myself from you too as well. I locked my office door and made it very clear to persons that you really don't need to come to see me. Yeah, you can pick up the phone, call me. So I maintained my zone. And about 2 weeks after, I think they felt very comfortable that,
Yeah.
So I understand the whole stigmatization and I try to help in the process.
Yeah. This is you really, really good analogy there, that knowing you had COVID and scorning, but then all the other people they're moving with and they don't have a clue. COVID is deadly, guys. Very silent, very deadly. Thank you so much, everyone. Your final, you have each have a couple seconds to just tell us something finally that you want the general public to know. Start with you, Sherry.
Okay. For those who have not taken a vaccine as yet, we have 2 choices in Grenada. I urge you to speak with your doctor, speak with a nurse, get some advice and take a vaccine. It's our best shot. It helps, and it not only protects you, but it protects your family as well. We need to boost our immune system. And at least take a 15 minutes in the sun per day. I remember under my 14 days, I had my 20 minutes of sunlight a day, and that helped a lot.
Good.
It did.
Good.
Right? So that's basically my advice. Thanks for the time.
Thank you so much, Sherry. Really appreciate it. Thank you so very much for sharing your very private and personal journey with COVID, and best wishes. TC?
Hi. Truthfully, I haven't much to say to the general public. I think everybody's adults and everybody will do what they need to do or what they want to do. As I will say, it's up to them, to protect themselves and the people they love. And in doing that, they're going to protect the whole population of Grenada too.
Yeah. Thank you so much, TC. Thanks for consenting to this, and I'm happy you're on the mend. Can't wait to see you again.
Me too.
Roger?
Allie.
Yes, my brother.
Roger? Roger?
Yeah, I just want to encourage people to get to trusted sources. Do you trust the WHO, CDC, or do you trust a website that goes by the name therealmedicaldog.com that you've never heard of? And look, you've got to be very objective, and there are several arguments outside there, and they are all different. So you hear persons are saying, why take the vaccine if you're going to still get the virus, right? That's a different argument as opposed to taking it helps you with a fighting chance of staying alive. The arguments of, well, this was created for big money, big pharma to make some money. All right, well, let them make the money, right? Your life here is what's important. The virus is real, it's out there. It presents some near and present danger to us, short, medium, and long term, right? While we may overcome it naturally, then you have to look at the long-term impact that it's going to have on our organs and so on. And if this thing was really man-made to damage us, or it was really man-made for some profiteering purpose, at the end of the day, you will obviously need some man-made intervention, that's my belief, to help buffer you. The vitamins and the C and the zinc and all of those supplements that we take, right? That's what it does, to buffer. So look at it that way, and I'll encourage everyone. There's no sitting on the fence. You should not. I don't know what we are waiting to see again. It's real, it's here. Get vax, right? I think it's going to really help us. A fighting chance to stay alive in the short, medium, and long.
Yeah. Thanks, Roger. Thank you so very much. And to wish you well, you and your family. Thanks for consenting to do this. All three of you, really appreciate it.
Appreciate anytime.
Yes, have a great day. And thanks again, guys. Bye-bye.
You too, have a great day.
Bye.
Bye, guys.
Speaking
Yeah,
there
all the
with
best.
Mr. Roger Duncan, Fabian T.C. Charles, and Sherry Robertson, all survivors of COVID-19 in Grenada. Mr. Allie, Mr. Campbell?
Well, I'm going to be very short because we're running again almost 9 o'clock. So,
Gosh, Lord. And we say no 9 today.
just to say that I think we have it from the horse's mouth. The three testimonials we got this morning are all clear in the conclusion that the vaccination did help, has helped, and will continue to do so. And they're encouraging every Grenadian to go in that route. So I don't think, there's much more to say except that, this COVID affects us in many ways and our families, and we need to be careful about that. So I wish all three of them well, and I hope our Grenadians listen to that. And all the other things that Roger was speaking to that we pay attention to. This is your actual brother and sister here in Grenada that's telling you their experience.
Absolutely. It's no longer something you can't relate to. It's right next to you. Mr. Campbell?
I have the final say no. I think not because of Chris, but I think this program should be replayed. A person should look at it. And Chris, not because of,
it should be replayed.
Enlightening.
Yeah, it is.
I would say, and listening to the testimonies there, everyone should see this. I have hope and I'm encouraged.
Yeah.
Thank you.
Thank you so much. Thanks to both of you, Mr. Campbell and Senator Allie, for your this extended version. These days, perspectives really becoming extended, but it's all for the greater good and in the national interest of Grenada as we all lift and rise from wherever we are to serve our country. Yes. So thanks everyone who tuned in, the broadcast entities who brought us, MTV On Air Online. Thank you so much, MTV. We really, really appreciate you. Mikey Live, our own perspectives page, Partygrenada, TNR Communications, KG9 and Sister Isle in Carriacou. Nazim Benjamin, of course, he provided our professional streaming services. Mr. Kirk Oliver, our cameraman. Mr. Blondell George, our director. And for our executive producer, Richie Oliver, I am Brenda Baptiste. Do have a great day. Try to remain positive. Stay COVID negative. And we'll see you again. Keep hope alive, everyone. Bye-bye.
For persons with symptoms of COVID-19, testing is done within 5 days of the start of symptoms using a SARS-CoV-2 antigen test. If the result is positive, individuals are required to isolate for 14 days. Day 1 of isolation is the day of confirmation with a positive test. Retesting is not required for release from isolation. Once persons complete the required 14-day isolation, they can resume normal activities, observing routine public health protocols. If the result is negative, a PCR test will be done for confirmation. If the PCR test is positive, the individual is required to isolate for 14 days as above. If the PCR test is negative, the individual will be released from quarantine and can resume normal activities observing routine public health protocols.